Still on health, about 28,000 vulnerable and less privileged residents of Plateau State will be given free healthcare access cards for easy and affordable healthcare services in the state. This was made known at the launch and commencement of the Basic Healthcare Provision Fund, an initiative of the federal government aimed at providing primary healthcare services to all citizens, especially the less privileged ones. And TVC News correspondent Funam Joshua reports.
The Basic Healthcare Provision Fund is an initiative of the federal government of Nigeria under the National Health Insurance Scheme. It will capture children from the age 5, pregnant women, elderly people above 65 years, and people living with disabilities. This category of the citizens are to benefit healthcare services at subsidized and affordable prices. The Plateau State Contributory Healthcare Management Agency and the Primary Healthcare Board are charged with implementing the project as gateway to the National Health Insurance Scheme. A total number of 29,091 vulnerable and incapacitated residents across the 17 council areas of the state have been registered and will be the first to access the service in the state. A symbolic presentation of the free healthcare access card was issued to these few individuals at the event. The Director General plus Chairman Fabam Jenchan says the state government has paid the sum of 100 million naira as a counterpart fund to benefit from the scheme.
We shall issue the cards to them. Thereafter, we will start distribution cards to the 28,000 so they can start benefiting from these services. I have it on authority that the Plateau State Primary Healthcare Board is ready to that extent so we can have these services flow on the plateau.
The Deputy Governor of the state who stood in for the governor at the event assures that the present administration is working towards providing affordable healthcare services to all citizens in the state.
With this increased expenditure on health on the plateau and the provision of premium by the Basic Healthcare Provision Fund, it is our undying hope that maternal mortality rates will decline and our children will no longer die from preventable childhood illnesses.
Some of the beneficiaries who spoke to us applauded the state government for the privilege given to them to partake in the scheme.
With this thing, it will go a long way for me in my life cycle. For 1 year, I will be receiving treatment. I have to give kudos to the government of Plateau State.
I appreciate the program that the state government is carrying out, and I'm happy the way the selection was made. Not that my child was choosing, because other ones were also choosing. So I'm happy, and I pray that the state government will be able to sustain the program.
The service will be delivered across the 335 primary health care centers in each ward of the state for a start. Funam Joshua, TVC News, Jos.